One of the things I hear so often in clinic is people feeling like they have resting bitch face. So what does resting bitch face mean? Because we might all think we know people who have it or celebrities who we've noticed it on, but what actually is it? Resting bitch face is essentially when you look miserable all the time. It might be that you're just fed up of people saying to you all the time, come on, cheer up, it might never happen, or people actually actively avoiding you because they think you're angry all the time. The reason we're giving off that message is because very often it's to do with this kind of downturned mouth corner look, which some people just have naturally and other people develop more with age, combined with this tension held around the lip area, this sort of slight tightness. It just infers this tense anger that means quite often people will misconstrue you and read you when they first meet you in a way that you don't intend to be read, because actually you're a happy person. For some people, resting bitch face is just something that they're born with. Their anatomy has these slightly turned down mouth corners and does mean that they hold slightly more tension in their lip area. But for other people, it can be to do with the aging process, and particularly changing anatomy of the jaw, and the fact that as this jawbone shrinks, the muscles that pull down on our mouth corners become ever stronger. Deflation of the lip doesn't help, and that combination can just lead to the lips looking thinner and more drawn down. So while for most people it's this combination of tension around the mouth and downturned mouth corners that really gives the resting bitch face look, for other people it can also involve the nasolabial folds and the marionette lines, this sort of drawing of the eye to this central area around the mouth, and this strong downward messaging that just adds extra sadness and anger to how we look, even if that's not how we're feeling at all. And of course, it can mean that multiple areas need to be addressed to provide adequate balance to this emotion that we're unintentionally expressing. So really the key thing here is to have an assessment with an expert, because it can be that there are multiple things going on. Some people might do really well with just a small drop of muscle relaxant into these strong depressor anguli oris muscles to give a nice slight upturn to the mouth corners. But for many people, it's a little bit more structural than that. And I really would recommend exploring facial fillers here. Fillers into the lips themselves give support to the area and can give a softness if people are tending to purse the lips a little bit more. Certainly we can treat the mouth corners, and the marionette lines can also be really treated effectively, provided the cheeks are adequately volumized first. So this is where the assessment is so important, because I would not want to treat someone in the nasolabial fold or the marionette line before we have adequate correction in the cheek. Especially when these areas are a little bit heavier, they can just take so much filler to be visible, and we can then end up with a widening of the chin and the mouth area rather than this more lifted look. So I would always assess whether someone has a cheek volume deficit first, treat that if appropriate, and then fine tune in the nasolabial folds and marionette lines. There aren't really any treatments that enormously contribute towards the treatment of resting bitch face, because this is so much more about structure and animation. So for me, treatment of this really lies within the realm of injectables. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.